What's up, guys? So Sunday's Ask the Doc. Last week we had somebody ask about hip impingement. So I wanted to cover that today. First, let's define what a hip impingement is, because there's actually two versions of it. There's a true anatomical version of it, meaning there's a deformity to the hip joint, whether it's the acetabulum, which is the cup portion of the hip, or the femur, or the head of the femoral head, which is the part of your leg that goes into the hip. Okay. There's either some type of anatomical deformity there, whether it's a cam deformity, there's osteophytes, there's dysplasia from birth, maybe, congenital defects, osteoarthritis. There's an array of things that can cause true anatomical hip impingement, and it's important to define that from mechanical hip impingement. And that's the big thing that we have to be concerned about when we're talking about hip impingement. So the best way to make sure you don't have anatomical hip impingement is to see a provider that will perform the necessary tests and imaging to rule out a true anatomical hip impingement. Now there's the mechanical hip impingement. So this one is more probably what's going on with the general population when they say I have hip pinch. There's pain in my hip every time I bend and squat. There's a pinch in my hip and it hurts. Sometimes it can be sharp, dull, and achy. And it's provoked with squatting, sitting for long periods of time, standing, any motion that's going to go from hip flexion to hip extension. And that one's usually due to a couple different things. Weak muscles, either from not being used, or tight muscles because we're in a position for too long. Both of those can be treated very much with physical therapy, chiropractic care, strength and conditioning, joint mobilizations, manual therapies. An array of different things can definitely help that. But you should definitely see a provider to make sure that you're taking the right course of action. Because if it's in a true anatomical hip impingement, you could actually make it worse with certain exercises, stretches, and treatment options. So it's important that you get checked out because of that.